the two primary vaccines we see are mostly the Pfizer and Moderna. Side effect-wise, have been really minimal. Most people have a little bit of symptoms after the second vaccine, typically a day or two flu-like symptoms, and then they get better. We really haven't seen side effects. A lot of the reported side effects that are out there from anti-vax people are not really true. We don't see them in the studies. And I try to educate my patients about all that because people are hesitant. These are new things. They're a new vaccine made in a new, unique way. Vaccination, I can tell you, to me, is the most critical thing we could be doing right now. All my patients in the hospital that wind up hospitalized are unvaccinated. And it's just a really very low likelihood of being hospitalized or dying if you're vaccinated at this point. I can tell you my experience since the Delta variant has been around, and then obviously that's also the time where we've had a lot of higher vaccination rates in general around the country, is we haven't admitted vaccinated patients. The statistics would tell you the vaccinated people that wind up in the hospital are over 85, or they have chronic immune suppressive type syndromes, cancer, things like that. And those are the people maybe the vaccine didn't take as well in because of the way their immune system works. But the people that are vaccinated where they have a good immune response, they're not winding up in the hospital at all. I think it's an education issue, and it's hard. I would argue there's people you're never going to get past their views, maybe their political views, maybe they're just views held for other reasons. But there are plenty of people out there that it's purely about educating them, having them understand the benefits of a vaccine and the risks of a vaccine and why we're doing it, And that's the conversation I have day in, day out with my patients as well, too. I think primary care doctors, people like myself, are some of the people that are going to be more trusted by the community and by people in the community. But it's important for young people to hear this message, too. Especially now the vaccines are approved, at least emergency use-wise, for 12 and over. Teenagers need to be able to advocate for themselves. They need to be able to talk to their parents and tell them, hey, I want to be vaccinated. I'll share a funny story with you if you want.
Sure.
Our 7-year-old the other day looked at us and we were talking about the vaccination, and he said, well, I want to be vaccinated. And his mom kind of looked at him, my wife, and she said, well, why? He goes, well, you don't want me to get coronavirus, do you, Mom? So kids, if you talk to them about it, they will understand. And obviously as a parent, you have to make that decision with them and for them. But it's just so important to consider the risks and benefits of anything we do. And this is a clear-cut choice, in my opinion. Benefits of the vaccine way, way far outweigh any idea of any risk, for sure. I got vaccinated to protect people, I vaccinate myself, I protect myself, but I protect my family, I protect my patients, and I help protect the community too. There's many motivations, and I tell patients all the time, it doesn't matter to me what motivates you to get the vaccine, just go get a vaccine. Because the statistics and where we're at right now don't lie. I just encourage people to look up things and utilize websites and sources that are reliable. You should get your information from medical resources. That to me is the most important thing. The biggest hesitancy we hear out there is people getting bad information or true disinformation. I really think you need to be looking at reputable sources. For kids, that's the American Academy of Pediatrics. For adults, CDC, whoever you want to use, but there's good reputable sources out there that can give you good information.